Hi, I'm Dr. Mike. I'm a licensed pharmacist, and I'm going to tell you something about marijuana today that you might not have understood, specifically exactly how marijuana works to help pain. So, when we think about pain, we need to think about nerves. So let's think about my foot. Let's say my wife comes by, steps on my foot, or she could come by and break my toe with a stiletto. How does my brain know the difference? When that nerve goes from my foot all the way up to my brain, the first place this nerve talks to another nerve is right here at the base of the spine, and that's called a synapse. So the nerve will fire a signal, which is called a depolarization. And when one nerve talks to the next to move that signal along, that's called a synapse. Now, the way that happens is a series of chemical events, and it's a physiological process. It's not too difficult to understand. But suffice it to say, a depolarization comes down the line, and it causes a synapse, and then that depolarization will then go through the second nerve up to my brain for interpretation. Again, to that interpretation, how does my brain know how bad my toe is hurt? The way my brain knows how to interpret that pain signal is by the frequency of firing. So a nerve signal or a depolarization doesn't just happen, okay, boom, there's pain. You touch a hot pan, there's one signal, it tells you there's pain. It is actually a repeating signal, and it is pain, 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 pain. So what we have is neurotransmitters release through the cleft, they're taken up on the postsynaptic side, and then they're kind of resorbed all the way around. And this happens faster than you can get your mind around. It is literally kind of a push-pull, depolarization, repolarization, depolarization, repolarization. And that depolarization, repolarization happens in the nerve terminal through ion channels and the movement of sodium ions, potassium ions, calcium ions, and things and chloride ions. So think about how my brain processes this. The depolarization is actually a change in electrical potential at that nerve ending. So the way we know the difference is, think about somebody firing a shotgun in the field as fast as he can fire a pump shotgun. Right? Now, compare that frequency with the frequency of a minigun on an A-10 Warthog attack jet, right? Massive difference in frequency. So now we know that the nerve signal or depolarization comes from one nerve through a synapse to the next nerve, and the rapidity or the frequency of that depolarization is what determines the magnitude or the amount of pain my brain perceives that I am in. Now, if you've ever really hurt yourself, broke a bone, had a bad cut, you know that at first it hurts like really, really bad, super crazy, but within a minute to 2 minutes, that super intense, sharp pain begins to subside and turn into this dull kind of throbbing pain. And that's because of your endocannabinoids, the cannabinoids that your body makes inside your body. And the reason it does is it happens on the postsynaptic. So the nerve that's receiving this intense signal is then signaling back to the nerve that's sending it, hey, you need to slow down. And the body achieves that through endocannabinoids that are made on demand on the postsynaptic side, and then come up here, they bind to the ion channels. What are they? They don't bind to the ion channels, they bind to their own receptors. When they bind to the endocannabinoid receptors, those endocannabinoid receptors cause a conformational change in the ion channels, so the ion channels just don't work as well. So you have a depolarization or a signal, and then the nerve will have to repolarize, which endocannabinoids cause that process to slow down, which means the frequency slows down, and therefore the perception of the pain that we're in also slows down. Exogenous cannabinoids like THC, tetrahydrocannabinol, and CBD, cannabinoids that are found in the marijuana plant, also bind to cannabinoid receptors on the presynaptic side of the cleft. They cause that conformational change in the ion channels and slow down the rate at which that nerve can repolarize, thereby decreasing the frequency and decreasing your perception of pain. That's exactly how they work. What else works that way? I can tell you what else works that way. Opiates work that way. Opiates bind on the presynaptic side of nerve endings to opiate receptors. That opiate receptor, when it's bound, causes a conformational change in ion channels, and decreases the rate a nerve can repolarize, thereby decreasing the frequency of action potentials at consent, and then decreasing your brain's perception of the pain that you're actually in. Now, what do we know about two drugs that have the same end result, but come about it by different mechanisms? One is an opiate that's binding to an opiate receptor. Two is an endocannabinoid or an exogenous cannabinoid like marijuana binding to a cannabinoid receptor. Both of those receptors will cause, in the end, through a process, a conformational change in the ion channels and decrease the rate at which the presynaptic nerve can repolarize to fire another nerve. What do we call two drugs like that? That's called synergy. It's in fact the very definition of synergy. And it is why, as we know from a number of studies, specifically this study by Bradford in 2018, I think it was, and what they found is in states that legalize marijuana in any form, whether it be recreational, whether it be medical or grow only, in those states they find a decrease in all opiates prescribed simply because those states enacted marijuana legislation. Now, this does not carry over to other meds like blood pressure meds and diabetes meds. This is specifically pertaining to opiate medications, and it's because if someone who's taking opiates wants to decrease their dose, the addition of marijuana to that, very slow, but the addition can allow them to decrease their dose of opiates, and that's what I've seen in practice so many times. So hopefully this has helped you to understand exactly how marijuana helps decrease your perception of pain and why marijuana works synergistically with opiates to help them work better at lower doses and not have any additional interactions or side effects on top of that, because marijuana has no effect on respiration. So hope you understand that a little better. Thanks a lot. Have a great day.